Hi, it's the nursing professor here. This is number 2 of preparing you for your finals, and today we're going to talk about pharmacology. All right. So there's 8 concepts that we're going to talk about today. One is drug classification. This is the best way for you to actually learn your drugs because it's impossible for you to know them all. So if you learn the classes of drugs, you know how those classes respond, then you should be able to match the drug to the class when you're given a scenario. So some of the major classes would be beta blockers. We know that that decreases heart rate, so we need to make sure that that person is checking their heart rate before taking it. If it's under 60, may not be time for them to take it. We also know that it is contraindicated with people who have asthma. So remember those 2 exceptions to the rule. ACE inhibitors, those are things that end in pril, like lisinopril. Lisinopril is one of those drugs that are used for blood pressure, and it works until it doesn't, because for some strange reason, it is one of those drugs that can be highly allergic, even though a person took it for 10 years. So again, something to remember. Diuretics, you pee, that's like your furosemide, your Bumex. So with those, you want to be concerned about electrolyte imbalance, because along with pee comes all the other stuff that's coming out, and sometimes those electrolytes can become low. Antibiotics, we know that those are used for bacteria. We know one of the big side effects with antibiotics that could happen is C. difficile. If we're thinking of C. difficile, we know that we need to use soap and water with our hands, never hand sanitizer. And so we need to be aware of that. Antibiotics do not work for viruses. I don't care what your patient tells you. All right. Another class could be blood glucose lowering agents. So you want to know all of your insulins, know which ones work fast, which one works slow. Your GLP-1s, you want to know those, your things like glucophage and things like that. Calcium channel blockers, SSRIs. SSRIs is really, really important for you to note as well, because that's going to come back up when we start talking about mental health. All right, 2 other terms you need to be familiar with, and this is concept number 2, is pharmacokinetics and pharmacodynamics. Know the difference between the 2. In pharmacokinetics, I always think movement, because kinetics means movement, and the acronym to remember with that is ADME, A-D-M-E. A stands for absorption, D stands for distribution, M is for metabolism, and E is for excretion. Those are quite important because as drugs are metabolized, then you need to make sure that you're paying attention to liver and kidney. In particular, liver is where a lot of the metabolism happens, and kidney is where the excretion happens. Okay, then pharmacodynamics is basically this. That drug does what it's supposed to do. If I got a headache, I take some acetaminophen, I should get some relief from the headache, period. That's really a down and dirty way of knowing pharmacodynamics versus pharmacokinetics. All right, concept number 3 is side effects and adverse reactions. Side effects can be common side effects, or it could be life-threatening. Common side effects might be something like diphenhydramine. You take that, you get sleepy. All right. Or it could be such that you take an antibiotic that you never took before, like a sulfur drug, and you end up with a whole angioedema that can be life-threatening. Anaphylaxis could be a life-threatening adverse reaction. Ototoxicity, nephrotoxicity, understand that those can happen with antibiotics and with furosemide, believe it or not. Yes, it can. The extrapyramidal symptoms, we want to make sure we pay attention to those. Many times that happens with the mental health drugs like the antipsychotics, the SSRIs, antidepressants. So we need to make sure that we're paying attention to make sure persons don't have that abnormal movement associated with taking those drugs. Antiemetics sometimes will also result in the extrapyramidal side effects. And by the way, this is one book that I found. There's a nurse here on, she's on social media. I think it's TikTok. It's called RNEssentials.org is where this is. I know she's on TikTok, but this little book here, if I was studying for NCLEX, this would definitely be the book for me. It is categorized as far as classes of drugs, which I've already talked about. It has all your psych meds together, which has all of those extra perimeter side effects, and it does a really good job of that because you know those drugs can be quite complicated. And then it gives you all the important information. So if this is something on your list, maybe a Christmas gift or something, this might be the book for you. And I've been teaching for over 20 years now, and I've never seen a pharmacology book as good as that one. So I don't put my name behind much. You all know that, but that is actually a good one. So number 4 concept is to know your dosage calculation and IV administration. So you want to know your basic formulas, like to determine rate, you're going to have your total volume over time. The volume always means liters or milliliters. Time is usually in minutes. Pay attention to the question and see if it's asking you how much per hour or how much per minute. You also want to know how to calculate dose to administer, which means you have the desired dose, what your order says, over the dose that you have on hand times the quantity. That's going to give you the dose to administer. Then last but not least, if you're given a drop factor, it's given. Don't busy your head up with trying to understand that. That is a drop factor that is in that tubing that's actually given to you. Usually drop factors come into play when you don't have a pump. And so there you're going to go back to your total volume times the drop factor over the time, which again is usually in minutes. So learn those formulas. You should be fine with that. All right. Number 5 is medication interactions and contraindications. You should definitely know that. Many of our medicines don't work with other medicines. For example, if somebody's on warfarin, you don't want them to take NSAIDs because both of them have the likelihood of some sort of bleeding. Beta blockers, as I said earlier, is contraindicated with people who have asthma. With going back to the warfarin, you want to make sure that you know that the lab that you do to assess whether or not the dosage is proper or not is a PT iron R. Vitamin K is the antidote. Heparin also is a blood thinner. The lab to measure that is a PTT, and the antidote is protamine sulfate. So those two you should definitely know as well. Anticonvulsive seizure medications, warning is that they should not be using operating machines like cars even. Sometimes people can get a doctor's permission to do that, but they really need to be careful of that. And to know their therapeutic limit, because usually there's a blood test that will say that. Number 6 concept is be careful of special populations like those that are pregnant. Pregnant women can't take every medication. Those who are breastfeeding, same thing, because they can pass it on to their baby. The geriatric population, because their metabolism is slower. So you want to be careful, especially with pain medications, that they're not getting maybe a dose that's too high for them. Pediatrics, same thing. They're on the opposite end of the continuum. So you want to use weight-based dosing when administering medications to pediatrics. People who have liver failure, kidney failure, those are another part of special population to be very cautious about because those organs are not working optimally. Concept number 7 is make sure that you know how to teach your patient, that you're going to be careful with teaching your patient when to take the drug. Do they take it with meals, not with meals, foods to avoid, like with vitamin K. With warfarin, again, going back, you don't want them to have dark green leafy vegetables that may be high in vitamin K. You don't want people to take statins and certain blood pressure medications with grapefruit juice. Those types of things you need to be aware of and to monitor for side effects. And last but not least is therapeutic drug levels like digoxin. You want to know what that normal limit is. You want to know normal limits for like lithium, warfarin, phenytoin, and theophylline. Those are just 5, but they might be more. So know those. And so I hope that helps you be prepared. Please like and share the video. Pass it on even to people who are studying for NCLEX. I will see you next video. Bye for now.